Efficacy versus potency. At first, it can be hard to define the difference between efficacy and potency. Textbook definitions of these terms always seem so abstract to me, so I'm going to break it down for you with some simple examples. Let's start with efficacy. Say we have two drugs that do pretty much the same thing. They cause numbness or loss of sensation. Drug A we will call frozen cane, and drug B we will call numb cane. These drugs remind me of candy canes, and candy gives you cavities, so this example will take place in the dentist's office. Now, drug B, numb cane, causes loss of sensation in your mouth so that as the dose increases, your dentist can perform minor procedures like teeth and gum cleaning without any pain. However, if your dentist all of a sudden needed to do a root canal or remove a tooth, well then, numb cane would not be enough. He would have to use drug A, frozen cane, which also causes loss of sensation in your mouth, but as the dose increases, it causes a greater loss of sensation than numb cane. Therefore, we would say that drug A, frozen cane, does a better job at preventing pain than drug B, numb cane. Or in pharm language, drug A has a greater efficacy than drug B. Efficacy is a measure of how well a drug can produce a response, or the maximal effect it can produce. Taking a look at the graph from your book, a drug's efficacy is represented by Vmax, or the drug's maximal height on the y-axis. As you can see, drug A has a greater y value, or Vmax, than drug B, and therefore has greater efficacy. Moving on to potency. Why don't we use our dentist's candy cane drugs again, but now drug A, frozen cane, and drug B, numb cane, will have the same efficacy. They have the same effect at preventing pain and can both be used for simple cleaning procedures as well as root canals. The difference this time around is the amount needed to cause a loss of sensation and prevent pain. The dentist will need, let's say, only 10 milligrams of frozen cane compared to 20 milligrams of numb cane to produce the same effect. So less of one drug compared to the other to produce no pain. Therefore, we would say that less of drug A, frozen cane, is needed compared to drug B, numb cane, in order to produce loss of sensation or pain. Or in pharm language, drug A has greater potency than drug B. Potency is the amount of drug required to achieve a desired effect. Drugs with higher potency have greater affinity for their receptors, or as you recall from enzyme kinetics, a smaller Km. Taking a look at the graph, a drug's potency is represented by the EC50, which is the amount needed to reach half the max effect on the x-axis. As you can see, drug A has a smaller x value, or EC50, than drug B, and therefore has greater affinity for receptors and greater potency. To test your understanding of this concept, let's work through the following question. Would you say epinephrine has greater efficacy or potency than the drug Pindolol, specifically when speaking about their effect on the heart? Now, to answer this question, you first need to ask yourself, what is the mechanism of action of epinephrine and Pindolol on the heart? Epinephrine is a stimulant and works on the beta receptors of the heart to produce a maximal response and increase heart rate. We call this a full agonist. Pindolol, as you might recognize from the ending -olol, is a beta blocker. But it doesn't just block beta receptors like our normal beta blockers. Instead, pindolol works as a partial agonist. To review from our lecture on receptor binding, a partial agonist alone has intrinsic agonist activity, but with a lower maximal effect. And in the presence of a full agonist, will actually have antagonist activity, meaning pindolol alone is a sympathomimetic and will act to a lesser extent like epinephrine, increasing heart rate. But when given in the presence of a full agonist like epinephrine, it will actually displace epinephrine from receptors and decrease heart rate, acting like an antagonist, aka a beta blocker. Okay, getting back to the point. Now that we have reviewed the mechanism of action, does epinephrine have greater potency or efficacy than pindolol? Epinephrine has greater efficacy. Potency is not a factor here. Pindolol, being a partial agonist, produces a lesser response than epinephrine.